Okay, today I will be administering a ophthalmic or eye medication on a Mr. Carl Johnson. I'm going to start off by going through my 3 medication checks following the 5 rights of medications. I'm also going to make sure that I have either my EMAR or paper MAR pulled up so I can properly administer this medication. In this case, I have a paper MAR, so I'm going to make sure that it says eye drops on here, and it does, and it's under Carl Johnson. I'm also going to check for his medical ID number, his date of birth, and any possible allergies on here. It looks like penicillin and acetaminophen, and his birthday is 4/1/50, as well as making sure that it does say eye drops on the MAR. So under the eye drops, you're going to check for any instructions, times, and it just says 1 drop in each eye daily. So that means both eyes, not just one or the other. And then I'm going to go ahead and identify myself by name to the patient. Good morning, Mr. Johnson. I'm Katrina. I'll be your TMA today. And then I'm going to go ahead and do some hand hygiene, wash my hands. And then I'm going to go ahead and explain the procedure to the patient. So, good morning, Mr. Johnson. My name's Katrina. I'll be your TMA today. I have some eye drops to administer for you, and they're going to go in both eyes. Okay. Then I'm going to go ahead and provide privacy for him and put on my gloves. I'm also going to want to make sure that there are tissues available, whether they're in the room or I bring some with. So I have the tissues and the gloves. And then I'm going to want to make sure to position my resident with the head or his body sitting in the upright position and his head tilted back. And then I'm going to take the tissue and I'm just going to make sure I'm going to wipe the inner eye from the canthus out and use a brand new tissue for the other eye. So we can go ahead and go through and do that. So Mr. Johnson's in an upright position. I'm gonna have him tilt his head back, make sure he's still in a comfortable position and it's not causing pain. I'm gonna take my tissue, wipe from the inside out, grab a new tissue, go from the inside out. Okay. And then I'm going to make sure that I'm using a gloved finger. I'm going to pull the lower eyelid down gently. I'm going to make a little gap between the lower lid and the eye. And I'm going to have him look up as I administer the eye drops. So I'm going to make sure that, again, that the eye drops say eye drops, optic drops, not ear drops. Make sure that the information on here aligns with the stuff on the MAR. Make sure that this is the top care eye drops and it says 1 drop in each eye daily. So then I'm going to go ahead and remove the cap and I am ready to administer the eye drops. Okay. So for this purpose, we'll say his head's tilted back, but I'll just show you. So I'm going to take a finger, gently pull the lower lid down, and apply 1 drop into that gap between the lower eyelid and the eyeball. Make sure that made it in the eye and there's no discomfort. And then I'm going to go for the other eye, do the same thing, pull the lower lid down slightly, and place 1 more eye drop in the other eye in that gap we've created. Okay, and then I'm going to have the resident make sure he closes his eye and gently press on the inner canthus for about a minute. And just making sure that I'm repeating the process and waiting 5 minutes for the medication to absorb before going through with any more eye drops. Although it does say just 1 drop in each eye daily, you want to make sure that you did get the 1 drop in so the medication could do its job. I'm also going to provide him a tissue and make sure that I have wiped any excess medication from the eye area. and make sure that Mr. Johnson is in fact comfortable and in a good position of comfort. Then I can go ahead and clean up. So again, similar to the eardrops, want to make sure that this gets back into the right place and the cap is on, but not too tight, so you can re-administer them, but not too loose so it'll spill. And then we can go ahead and dispose of any tissues, our gloves, perform hand hygiene on the way out, but also make sure that the call light's within residents' reach, and making sure that any new pains, discomforts, problem with the medication, or allergic reactions immediately get reported to the nurse. And then again, just making sure you're documenting, so you did your 3 medication checks, and within your 5 rights of medications. And then just going into the MAR, going under the eye drops, and putting that I administered the eye drops at 8:30 this morning into his right and left eyes, 1 drop each, and initialing it. And then making sure that at the bottom or somewhere within the paper MAR is your full name stated next to your initials so that you can be identified, and making sure that today's date and the time administered is for sure on there. That way they can keep in check with when they get their next dose.